marijuana use for cancer patients. This is one of the most requested topics that we have within our community, whether it's through our roundtable events, our community events, or even our social media platforms. This topic seems to be controversial, but many myeloma patients have found pain relief thanks to these medicines. There are also things that we need to consider, however, such as what are things that patients should know about these products and what are the risks and how could it possibly affect cancer treatment. We're excited to hear more about this and what we need to know regarding medical marijuana and CBD use with cancer generally. So it is now my pleasure to introduce our featured speaker to you. Dr. Narupa Raghunathan is board certified in pediatrics and internal medicine and has experience at Memorial Sloan Kettering in both cancer survivorship and integrative medicine. She is the director of pediatric integrative medicine with a consultative practice, as well as oversight of the PEDS IM program. She also has a CBD medical cannabis consultative clinic. These practices help guide active patients and survivors, as well as their caregivers, towards important and supportive integrative therapies while advancing the mission of providing personalized care through and after cancer diagnosis. We are so excited to have you here today. Thank you for joining us, and the time is now yours. Thank you so much.
Thank you so much, Audrey, and I'm happy to be here with you guys. I'm going to share the screen in a second. Hopefully it all works out. So I'll just let Audrey let me know if you see my email. So let me just really quickly put this in. All right. So I'm going to talk about cannabis and cancer. Let me just re-summarize a little bit of what Audrey said about my background. I, like she mentioned, I'm board certified in both pediatric and adult medicine. And as a part of my role at Memorial Sloan Kettering, 3 or 4 years ago, I was in survivorship, kind of transitioning to integrative medicine. And at that point, I had colleagues in the oncology departments asking a lot of questions about CBD guidance, and really realized there was a need, and kind of dived into that side of supportive care or integrative supportive care. So what's important to understand from that perspective is that while I do have many myeloma patients, they are not the exclusive patient population I work with. And so I'm going to talk about cannabis and cancer, including CBD, in kind of the more general sense, and definitely can talk a little bit more specifically about the common symptoms associated with cancer and cancer treatment that are specific to myeloma, as well as what little research there is about cannabis specifically in myeloma. But the caveat for all of this is always that kind of the field of how cannabis and cancer intersect is evolving and interesting and very, very new. And so we take that, everything I say, kind of with a bit of a grain of salt in terms of what is known. So anyways, thank you for having me. I'm going to first start by saying I have no financial relationships to disclose. And I always like to start this presentation just to understand the terminology. It can be very confusing and people can use a lot of words interchangeably. And so it's often helpful just to understand what is meant by a specific term. So you will hear me say cannabis, generally speaking. I know that a lot of people refer to it as marijuana, but cannabis is the scientific species that we are referring to. It is the name of the plant. And, some people will be familiar with the subspecies of Sativa indica and ruderalis. What's important to know is cannabis as a plant has evolved a lot in the last 50 to 100 years, basically as a result of understanding cross-propagation and the movement of plants across borders, et cetera. A lot of the characteristics of each of these subspecies have essentially been bred out. And so while people can refer to sativa and indica, it doesn't have as much clinical significance in my experience. Then the term marijuana. Marijuana is a Spanish word for cannabis and essentially largely designates the forms of cannabis that contain THC. And I'm going to go into a little bit more detail about THC and CBD, but usually when people speak about marijuana specifically, there is that idea of the types of cannabis that can cause a high. I won't use the word marijuana very much because it does have some negative cultural connotations, a little bit pejorative. But I will say when people talk about medical versus, recreational cannabis or marijuana, it is not, there's no distinction between that. There's not different plants that are medical versus non-medical. It really refers to regulation and manufacturing guidelines that allow them to be sold in a medical dispensary. So I just want to always make that clear. It's not produced by a pharmaceutical company or anything like that. And then I want to also reference hemp. So hemp is also cannabis. So essentially cannabis sativa or any of these cannabis that don't have THC are hemp. So if you looked at a plant, cannabis plant in the ground, you would not know whether it is hemp versus, THC containing cannabis. It's not visually obvious. Essentially, the hemp is whether it's hemp oil, hemp fibers that are used to make pillowcases, all of that is essentially just cannabis plant that doesn't have THC in it. And so it's not having the THC that makes it hemp. Lastly, the term cannabinoids simply means the different chemicals that are in THC. They are the ones that have some activity at cannabinoid receptors. CBD cannabidiol is one of them. THC or delta-9 tetrahydra, and I always forget what the last part of the C is, are both cannabinoids. There are other ones that people often hear of or might read about: CBG, CBN, THCA, etc. Those are just, again, other chemicals that are in the cannabis plant. These are significant because they do interact with our body. I often like to think of it, cannabinoids kind of use opioids as a parallel. So we often think of how opioids, interact with our body, and that's because we have opioid receptors. In that same way, cannabinoids react to our body because we have cannabinoid receptors. And this is where I will tell you, I'll give you guys a heads up through this. I will make jokes and you may or may not receive them, and I won't know because we are on a webinar. So I hope this one is funny. But basically, the whole reason people ask me about cannabis because it has an effect on our body. That's why no one asks me whether they should be smoking basil. So, all right. So how do they even work? Why do we even care? So there are thousands of cannabinoid receptors in our body. Importantly, two categories, CB1 and CB2, are the ones we have the most information about. CB1 receptors are the ones in the brain. They are found in the central nervous system as well. And then the CB2 receptors are the ones that are on immune cells. We know that the CB1 receptors are very present in cognition, short-term memory, the basal ganglia, which is movement and motor function. And this kind of pairs well if you understand what THC does, right? If anyone knows what THC's effects on the body are, they tend to lead to a high feeling. Well, what is a high feeling? It is, decreased processing time or concentration, affects memory, and maybe affects a little bit of movement and motor function, kind of feel like you can't move as well. Now, what's important to understand is having CB1 and CB2 receptors, or receptors in general, doesn't mean you won't know how it affects a person. So everyone has different concentrations of these receptors. Just having them doesn't mean that when the drug or the medication or the substance hits the receptor, whether that means what the downstream effect is, because our bodies are very complicated. And that's particularly important with the CB2 receptor. The CB2 receptor is on immune cells, and we don't definitively know how it affects immune cells, which becomes really important when we're thinking about, one, the therapies that are often involved in myeloma or in cancer in general, and two, the underlying cancers themselves. So just to understand a little bit more about cannabinoids, because it's going to form a little bit of foundation of what we talk about. Cannabinoids are, we have natural body cannabinoids. So again, I'll use the opioid parallel, just like we have opioid receptors that, you know, if you hear those stories where someone, you know, feels no pain when they're lifting a car off of their dog or whatever, that's that kind of opioid, like you're able to kind of, or if you're an athlete, like, you know, performing through pain, that's a natural high, right? In the same way, we have our natural cannabinoids, anandamide and 2-AG. These are the two that have been discovered. There may be more. In that same parallel, phytocannabinoids. So there is a plant version of a cannabinoid, meaning chemicals that are in plants that have an effect on the receptors in our body. We use opioids again as a parallel. That's the poppy plant. That's the opium that, if I think of the scene in The Wizard of Oz, where everyone falls asleep in the, you know, field of poppies. And then we have synthetic versions of both of these. So synthetic opioids are oxycodone, methadone, et cetera. And then in that same way, we have synthetic cannabinoids. We do have some derivatives of THC that are man-made pharmaceuticals, but there is no known, at this point, there's no synthetic CBD. Okay, so how do these cannabinoids even work? The receptors, so that I always like to use this kind of as a reminder, medicine is a relatively new field, you know, like really understanding how different parts of our body work. The idea of receptors even is maybe 80 years old. So it's important to understand cannabinoid receptors were only identified in 1988, 1993. So that leaves us really early in the field of understanding how cannabis works. But we do see that our natural cannabinoids seem to have an activity in terms of pain, movement, eating behavior, inflammation, memory. So we keep that in mind for a couple of reasons. One, because we do want to understand how we can work with our cannabinoid receptors, whether that is through cannabis, phytocannabinoids, cannabis and CBD and THC, or making new drugs that are even more potent, but also because understanding what cannabinoids can do usually leads to different companies kind of making claims of what's possible with their CBD products. And I always use this as a moment for caution. For example, here you can see it's, you know, cannabinoids appear to have a role in bone growth. Does that mean you can say, oh, if you take CBD, your bones will grow? Absolutely not. We have none of that evidence. Basically, what we can just say is the receptor is present in the bone and seems to possibly, when you do it in a cell, help with bone growth. So just some background on CBD and why it's so interesting to us. We, you know, in a survey by consumer, not this survey, I'm sorry, wasn't consumer. I'm trying to remember those consumer reports. It may have been a clinical study. Anyways, an online survey of 2,000 respondents, 61% responded that they use CBD for medical condition. They've used CBD more for medical condition than people who didn't, those who don't use cannabis recreationally were more likely to use CBD, most commonly used for chronic pain, and often using the oil form. And a lot of people feel like CBD treats a medical condition just on its own, very well by itself. A Consumer Report survey similarly reports that 64 million Americans have tried CBD in the last 24 months, and 1 out of 7 Americans use it every single day. This is pertinent also from a, you know, kind of access standpoint. The CBD market is 327 million to 2017, projected to be 22 billion next year. And there are 850 different products. Well, there was a study of some of these CBD products, and only 31% were accurately labeled. And so it really is important to understand that, you know, hearing or reading about the benefits of CBD does not necessarily equate to a safe product that you're going to be able to find out very easily. I very strongly suggest like working with your physician or a experienced provider to really think through whether CBD or anything with cannabis could be helpful. But there are a lot of, if we distinguish CBD from THC, there's a lot of use of that as well. We know that legal marijuana sales are predicted to be 23 billion in 2025, so similar to the CBD market. That in 2017, 52% of adults had reported trying it, and 44% currently use it. Current use, meaning use in the last month, and 14% use it regularly. And 83% support some kind of legalization, whether for medical purposes, even including medical purposes. 49% in a poll, I want to say in 2019, said they approved for recreational purposes. And I recognize that there probably aren't many kids on this presentation, but I always like to say, you know, just to understand kind of the frequency of use, that it starts young, early, with 11% of 8th graders saying they'd used cannabis in some form in the last year, and that amongst 12th graders, even 6% said they use marijuana daily or nearly daily. So with all of that background, particularly understanding kind of the controversy or the environment around cannabis use, you know, it's always interesting to me, the medical connotation to it, in part because I don't know that there's enough definitive research. I'm going to go through what we do have, but it feels like it has this weight on it as being incredibly beneficial from a medical standpoint without really understanding the other side of it. There's a lot of perception of it being completely benign and better than, let's say, people will be like, you know, it's better to use cannabis than to drink alcohol. And I would make the point that both of those are recreational use. And so using alcohol as a counterpoint, it's not helpful because there's not many, you know, people who ask me whether they should be drinking a shot of tequila as a part of their cancer symptoms, right? And so you're not really comparing apples and apples, right? So, but if we did look at the potential for cannabis for cancer-related symptoms, the majority of the evidence falls in favor of favorably towards nausea. The CB1 receptors in the brain has a lot of activity on nausea. THC has more of an effect. The reason for this is THC, I compare THC to CBD in terms of its effect on the CB1 and 2 receptors, as THC is kind of like, if you had a dartboard, right? CBD is like, you know, really, or like a piece of art you're working on, sculpture. CBD is like a little bit like a chisel. It's very fine work on the receptor, whereas THC is like a sledgehammer. And so when we talk about this THC having more effect, it's because it is a much more intense affinity to that receptor. So that means that for nausea, for the really significant nausea that's often associated with chemo, the difficulties with appetite that are often associated with chemo, there is much more effect with THC, though some people will report benefit with CBD alone. Then in terms of pain, again, we think through the CB1 receptor, maybe through pain receptors as well. Is there some anti-inflammatory effect through the CB2 receptor? I've seen some studies of topical CBD having some benefit from peripheral neuropathy, but it's still unclear, and that research is still ongoing. And then there is in mice studies, there is some research around mood regulation and anxiety for mice. There is 1 or 2 studies of high dose CBD for like social anxiety. We're talking like 400 milligrams of CBD once for someone who's doing like, you know, stage performance. It's really not a sustainable dose. There really isn't much in terms of sleep for THC. There's a little bit around sleep for CBD. So the CBD seems to modulate some of the sleep-wake cycles. So again, these are, you know, 1 or 2 studies each versus, you know, let's say the intense number of studies you might see even around, you know, the therapies you guys are receiving, but even let's say Zofran for nausea, like that is a lot more study than let's say cannabis or THC is. It's also one of the big things everyone's asking or wants to know because they read about it is people, you know, talking on anecdotally about, you know, using cannabis to treat their cancer alone. Like you will hear those stories. They're not validated stories, unfortunately, but very appealing. I mean, when I read them, I wonder and I hope and I wish. But what we actually do know in terms of treating or preventing cancer itself, there does seem to be CBD potentially in cell studies that maybe has a protective environment against tumor development, maybe helps move medications, chemo type medications into, I'm sorry, are you guys still seeing my screen? It just kind of.
Yes.
Okay, good. Sorry, it kind of went off from.
It's okay.
So yeah, that maybe it helps the uptake of chemo medications into the malignant cells, so that kind of deviates them and maybe is protective to the normal cell. The particular circumstance, so that's for CBD. In myeloma, I've seen some really preliminary research looking at whether there's activity of CBD, cannabinoids, cannabidiol on CB2 receptors on myeloma cell lines and perhaps having some sort of effect on them. Some preliminary research also looking again in cell studies of synergistic effect with bortezomib. Anyways, one of the common myeloma medications. I'm going to say it wrong. So I think that there are people who are interested in that space, but you know, unfortunately, the problem a lot of times with cell studies is when you're looking at a very single cell, even a mouse model, the doses you're utilizing are not necessarily translatable to humans. So for example, if you're seeing in a cell study that CBD with bortezomib, let's say that that's the right pronunciation, shows improved activity, are you doing 1 milligram of CBD or 1 million milligrams of CBD, which is not feasible for the human being to take in? And so these all give us directions to move in, but are not really translatable into doses for anti-cancer. Now, THC has been studied a little bit more as an anti-cancer, particularly in a kind of a brain cancer called glioblastoma, which maybe with certain chemotherapy. So in cell studies and my studies found to be potentially beneficial. So one study of like 20 people with THC and CBD in a preparation that's out of a pharmaceutical company in England did seem to help improve outcomes for patients who are on their standard chemo regimen for this type of cancer, for glioblastoma. Was it curative? No, unfortunately, glioblastoma is a very, very serious cancer that is often fatal. So, you know, the prolonged survival. But the point is, like, those are the types of human studies that are hopeful, right? Like, is this existing thing, this chemical that we've kind of had around all this time, have a potential to have even more benefit? But I would say that that's also the reason why we can't put too many eggs in that basket, because cannabis has been around for thousands of years and been used for thousands of years, and we haven't seen that decrease the existence of cancer. So we can't, rely on it entirely to be a kind of miracle in that way. All right. So it's helpful to know what's actually available, so that I'm talking about all of this, but sometimes it's helpful to just know. Marinol is one of the synthetic THCs, Nabilone is the other, which was studied and approved for by the FDA for, CINV is chemo-induced nausea and vomiting, and HIV-related anorexia. So these were approved in the early 90s. A lot of studies went into allowing this to come to be, right? Because, plant cannabis now is a little bit more available, legal in certain states, et cetera, but certainly in the 80s, 90s was not available. And so it had to be made into a synthetic. And it's a synthetic THC, a lot of these medications for nausea and vomiting, a lot of the THC-based ones, like the offset of that is the high. And a lot of people who wanted to use this for nausea and vomiting found that the side effects of the high were intolerable, like just too much to use the cannabis primarily for nausea and vomiting. And so you will still see some people being prescribed it. And if so, it's, very thoughtfully done so. But, oftentimes people don't have variable benefit from it. Cannabidiol is something that was approved about 3 years ago for rare seizure disorders. So Epidiolex is the brand name. It was studied in a certain set of pediatric seizures. And so it's the only FDA-approved plant-based pharmaceutical, extremely expensive if you don't have, these pediatric seizure syndromes. But what's helpful around both of these studies is the THC. So cannabis as medical cannabis, the kind that you're certified for if you are in a state that has medical cannabis laws or allowances, dispensaries, has a combination of THC and CBD. And so these existing products, these pharmaceutical products, help us because we understand the interactions. We're going to go into that in a minute, but basically knowing how things have the potential to interact helps us, think about what is how do we safely use anything that is in the cannabis space. And since we have the cannabidiol and the dronabinol, marinol studies, we're able to say, okay, what can we expect THC how would it interact or interfere with certain liver enzymes and stuff. And then there's medical cannabis. And I'm going to discuss that in a second. CBD is a little bit different. So as I mentioned, hemp is defined as cannabis without THC. And this allowed farmers and manufacturers to be able to grow cannabis without having to worry about it being considered by the drug enforcement agency as illegal, right? And so that allowed them to grow cannabis plants and use it to make fabric and, oil for cooking and things like that. In 2018, the Farm Bill was expanded to say that, in 2018, CBD or hemp was taken off of the class 1 drug, and that's why CBD is available. But it's not regulated. Other than Epidiolex, no CBD products have been approved by the FDA. They have not decided whether it's a food or a drug or a supplement. As such, there's very little known in terms of the quality of the sources. I mentioned there's 850 different brands. It really is a roll of the dice as to whether if you go to a store, whether you're going to get a high quality brand, because there isn't much independent testing. there are a couple of different sources. Consumer Lab is a lab that tests supplements. And so, if I'm working with someone with cannabis or CBD, we'll kind of look through and make sure we pick a product that has some third-party quality data. The U.S. Hemp Authority is a nonprofit organization that wants to impose some kind of standards, and so has people certify for a U.S. Hemp Authority quality standard, meeting of quality standard. And the FDA website will sometimes have some warning letters and test results for CBD-related products. One thing I want to mention is full versus isolated spectrum. When something is full spectrum, it means that the CBD product will have trace amounts of THC. So hemp is defined as cannabis with less than 0.3% THC. So a CBD product that is full spectrum can have up to 0.3% THC. Isolated spectrum is supposed to isolate out just the CBD. And it's just, helpful to know that lingo, because sometimes you'll see a lot of advertising around that and not really understand what that means. Now, cannabis certification. Now, I recognize that I'm speaking to a national audience, maybe international, I don't know, Audrey, if that's possible. So I'm speaking a little bit more specifically to kind of the area I practice, which is New York, New Jersey, Connecticut kind of spaces, but recognize that each state has its own cannabis laws, and you have to be thoughtful to that. And if this is something you're interested in understanding more about, we'll want to investigate that further. So in most of these states, you need to have evaluation by a certifying provider if medical cannabis is allowed. So first start with which state you live in. Then a lot of them will need you to have a certifiable indication. Cancer is most often one. There are other medical conditions, and chronic pain is often in many states also considered a certifiable indication. So you need to certify, in New York, you need to certify diagnosis like cancer, and then a symptom that is associated with that qualifies you. And then it comes down to how is they providing it. Some states, they provide just literal flower or the bud. In others, there are plant product. The others, they'll kind of have distilled, like in New York, they provide it as oils, as vape, etc. And each of those formulations matters because their absorption is different. And I'm not going to, nearing the 30 minutes, and I know there's already a couple of questions. So I'm not going to go into that a lot of depth. And I will always say, caveat, I'm giving you guys some general information. It really is important that these are not recommendations by any means as to what to take. But I will say, I feel relatively strongly to not inhale the product because the understanding of how that affects the body is still not clear. And people who, particularly cancer patients and myeloma, have the potential to be immunocompromised. And if you're inhaling in something and it's got fungus or bacteria or something in it, you are much higher risk for some sort of complication related to that. Additionally, I just recently saw some research come out saying that inhaled cannabis can also have significant inflammatory effects on heart related to heart disease. So I would again caution that inhaled is not your best formulation if you are considering this conversation to have this conversation with a provider in terms of getting certified. And then dosing, oftentimes in the certification, the certifying provider will kind of work on, will need to provide some guidelines to dosing, but a lot of times different states have it set up so the dispensary is actually providing you those specifics. And so, working with a reliable dispensary is important. So again, in New York State, many people may not be on this call from New York State, but again, it requires, initial consultation with the dispensary pharmacist, making sure you're fully aware of what it says on the labeling. And I think this is universal across the country because of the fact that it is not federally legal. Cannabis containing THC is dispensaries and companies that work in that space cannot, I think that it's like a federal law where they cannot use credit cards. And so at least in New York State, I think in other places, it is end up being kind of a cash or cash app type business. And it's something important because it's not going to be covered by insurance. And, the cost of both medications for the treatment of cancer, as well as the managing the side effects, it matters. So just so you understand why dosing is so complicated, a lot of places, the way it's labeled is they might label in concentrations, like amount of THC to CBD and ratios in New York. So they might really do it in percentages, 2% THC, 8% CBD. So a lot of that is a lot of really nuanced, because you want to be able to understand exactly how many milligrams of each individual component you're taking in. And especially with inhaled, you don't really know how much you're taking in. CBD at lower doses can be stimulant, and so that can be really confusing. And then THC can actually precipitate anxiety. And so people who take THC for feeling like they're anxious and then get more anxious is actually a problem, because the dosing isn't clearly labeled, and people will think, 30 milligrams doesn't seem like a lot, but it might be for that person. Actually, it's probably a lot for a lot of people. The other thing is, what are you dosing for? So as I mentioned earlier on the presentation, there's a lot of different things that people are interested in it for, but not a lot of evidence at how to best dose it. It's only now we're getting more data, particularly from countries where it is fully legal, like Canada and Australia, that we're getting a little bit more data on how to best dose it. And so if you're dosing for a symptom, you kind of have some ideas of where to start, but it's still a little bit of like a trial and error. And then the last thing I want to mention is what I was mentioning a little bit before around interactions, right? So we're able to understand a little bit of interactions. We do want to be aware of the fact that the cannabis is, the liver enzymes do metabolize it. Because of that, it can interact with other medications. There's no clear maximum dose. And so sometimes because we don't have a lot of experiments to figure out what that max dose is. And so you just practice a lot of caution around the other medications that are being taken, whether we think the cannabis has potential to interfere with them. And this is only speaking about interference at the liver level. There are a handful of studies of certain immunotherapy agents, specifically what we call checkpoint inhibitors, nivolumab, Keytruda. You guys might have seen those commercials. And there is some studies of that being used for other cancer types, not myeloma, like lung cancer or melanoma, that showed that cannabis use with it in a population in Israel seemed to decrease the response rate to those. So like I said, you have cannabis, THC and CBD potentially acting at what we call the CB2 receptors, those on the immune cells. Well, if you're also trying immunotherapy and we don't know how the cannabis interacts with the CB2 receptor, are we actually blocking the way other medications work? And so when I talk about interactions, I'm really talking about just the liver. We don't have long-term studies on some medications to say that there isn't an interference with therapies, to be honest. So I'm going to stop there. I went over a little bit, but hopefully we still have time for questions. And I see that there are many, but I hope maybe some are able to be pulled together.
No, they totally are. They totally are. You're good. So I would say thank you so much, first of all, for that presentation. I learned quite a bit actually as I was going through it. So I really appreciate you sharing that with us today. If you want to stop sharing your screen so they can see you a little bit more clearly, I'll start with the question that a couple of them have, which is they're a little bit nervous, walking into that dispensary, where to start. And I know you can't give on an individual case-by-case basis, nor give specific recommendations, but what are general things that they should be looking for? I like that you talked about, inhaling probably isn't the best. Should they, if they're just starting out for the first time, should they start with oils? Should they start with edibles? Where do they start? And how do they know proper dosing?
Sure. So assuming you've gotten, so I want to be very clear. I cannot endorse or support the idea of just going to a recreational dispensary and starting somewhere. That's not, but presuming you have a certification, you're going to a medical dispensary. I would generally say, based upon the mechanism of action and how they're absorbed, it'd be better to work with an oil. The reason for that is, one, an edible. The problem that happens with edibles, this is kind of well described in movies and stuff like that, is that the onset of action is 1 to 2 hours. And so oftentimes people think that it hasn't had an effect and take extra, and then it takes longer to clear. It takes 12 to 24 hours for it to clear from the system. And so you can have a hard time isolating out the benefits of it because you took too much or something like that. So a pill, and I consider an edible the same thing as a pill, anything you swallow and then is processed through the liver. So an oil tends to be a bit more predictable just because the absorption tends to be a bit shorter time frame and usually is cleared within 6 to 8 hours. And so you get a better sense of how it works. The other reason I suggest, or I prefer to work with oils, is because you can titrate the dose more carefully. If you have a pill and you're trying to do a quarter of the dose, like how are you cutting it to make sure it's so cleanly a quarter, versus an oil, if it's the full dose is 1 full dropper full, you can do 1/4 of a dropper really easily. And that would be the reason why an oil, kind of from a dispense perspective, is better. I mean, I think that, when we become over the age of 12, we get so excited that we can take tablets. And then some of that is the failing of the pharmaceutical industry to make syrups more palatable. But at the end of the day, like, wouldn't we all like to figure out a way that instead of having to decide between taking 2 Advil and 3 Advil, could you figure out a way to take 2.5 Advil? And wouldn't that be nice to just use a liquid, right? So sometimes I think it's kind of shame that we move so quickly to tablets. And also capsules can be like big to swallow. And anyways, I would say like an oil is a little bit of a better formulation because of the ability to titrate, the ability to have a little bit more control. I would also say, I cannot, again, endorse a starting dose. What I would often say is the dispensaries, with, understanding there's always exceptions, dispensaries often start people at higher doses than necessary. I think it is worthwhile to start very low and move up gradually, because what you always want to do in these situations is think of what is the least most effective dose, meaning overshooting doesn't have any benefit to you and only puts you at risk. So if you can move into the right place gradually, then you're better off, because then you find that spot. And also, frankly, from a financial situation, be better off, because if you are taking, your dispensary gives you a 30 ml bottle and says take a full dropper every day or twice a day, you're going to run out of that in 15 days, because it's a dropper might be 1 ml. You're going to get twice a day, you're going to get to, but maybe your dose would have been just as fine at a 1/4 dropper. And now you've quadrupled your supply. So right. I would just say kind of half, if not 1/4, what your dispensary suggests, if it's possible. And then kind of move up from there very in gradual fashion. And, a good dispensary. So the other thing I do suggest is, no matter which state you're in, however you're working through this, is to kind of be a good consumer, buyer beware. Like, if you're deciding between dispensaries, don't just go for the one that happens to be 2 blocks away. Like, call around, find out what's within a radius, call each of them, use the very, very good skills you developed being, informed, like to even find your way to myeloma crowd.
Right.
Like, right. You decided you wanted to be an informed participant in this process. And so use those same skills, call them, see if they seem knowledgeable. They're not just trying to push product, as much as there's a lot of lore around cannabis and how like curative it is and it should be in the water supply or whatever. At the end of the day, it's a product that someone wants to sell. And so just be like, okay, like you're kind of pushing these products a little bit heavy. It should make you a little uncomfortable. Like it really needs to be about you. So I will tell people, like, find the dispensaries that are within a region, call all of the ones you're considering, make sure they seem reasonable, make sure they have an ample selection. In New York State, I can make designations. I can say specifically that only oils or only pills or whatever. And so I'll always tell people, like, the ones you're considering, make sure that they don't have like 50 different vapes and 2 oils. Because if I say oils only, they're going to force you into one or the other. You're not going to have a choice. And so having a choice means that you can be more nuanced. In New York, some of the dispensaries, in addition to oils, have powders and mouth sprays and lozenges, and all of those all fall in that same category. Would I suggest those off the bat first? Not necessarily, but if you find a stable dose that's equivalent to a lozenge, that's a perfectly reasonable thing to do. But if you're at a dispensary that only sells 2 oils, you won't have access to them. And so, do the work of, looking at what other things are there. Yeah.
Okay.
After that, it's just like you have to kind of hope that the dispensary pharmacist form a relationship with them and have them also help you in terms of guiding you in the dosing. Yeah.
Definitely. That was one of the questions, if my treating doctor isn't knowledgeable or maybe not even supportive of the medical cannabis, where do I go,
So that's a complicated question. So one, you do want your oncologist to be aware, because if there are things that change in your medical course, the same reason why you wouldn't want to sneakily take opioids, right? Like there's a reason you want your oncologist to know, because if there's a change in your kidney function, your liver function, it may change how they approach your dosing of your medications and stuff. So you definitely need your oncologist to know. If they're not supportive or don't know where to start, most states that have a medical cannabis program have a way to search for a medical cannabis provider that can certify you. And so that would be that part of starting. Other than that, there are some medical certifying providers that don't give much guidance. Maybe either they're uncomfortable with it, maybe frankly that it's like a machine and they just turn them out. I know that exists. And so the dispensary pharmacist will often end up being the person that's the most helpful to that.
Okay.
Yeah.
And then in terms of brands, you talked about there's 800 plus brands. What are the questions that they should be asking or the research that they should be doing in order to find those reputable brands?
Sure. So in terms of CBD, so I would say, US Hemp Authority does have those certified companies. And so if your provider is okay with you taking CBD, and so you are looking to purchase it, then I would obviously make sure your provider is aware and supportive of it, is look at that US Hemp Authority, because they have like 50 different brands, I think-ish, that have are certified from a quality standpoint. The other thing you're looking for is very clear labeling. Some of them won't delineate how much CBD is in it. And so it'll just say hemp, which again is just an oil. And so if it says 500 milligrams of hemp oil, well, that could have 0 CBD in it and be like a whole teaspoon, because it's just literally a weight, right? So you want to keep that in mind. You also want to see that it's not like some sort of proprietary formula or adding a bunch of other things to it, just because the last thing you want to do is use a CBD product, have an allergic reaction to another component in it. Like, they decide to fancy it up by adding, let's say, curcumin and ashwagandha or something. And then you have an adverse reaction and you don't know whether it's the CBD, the ashwagandha, curcumin. So now all three of those things are unavailable to you.
Mm-hmm.
So it's better to do something with anything kind of single so that you know your reaction to it more definitively. It's not, I think a lot of people feel like, oh, this has like 8 really good, I've heard 8, all of these 8 things are really great for me. This garlic, ginger, curcumin, mushroom, CBD combo. Unfortunately, one, I would tell you, I guarantee you, it's not sufficient amount of any of those subcomponents. You're actually getting underdosed on all of them. And 2, that they're probably interacting with each other, and you're gonna not really isolate out which one is having the positive effect for you. So if you felt a positive effect. So I would just say, make sure it's a very like simple product that you're just trying for that purpose, and to ensure that it's very clearly labeled, so you know exactly what you're getting, that the dosing is clear, because a lot of times they'll label out, like you have to do the math, right? Like a label will say serving size is half a dropper, but you have to do the math as to how many milligrams that is. And so a lot of people, the same way, like they used to have the big bottles of Coke that just said, it was very small print, that there were actually 8 servings in there, but it would be like 120 calories. And you're like, this entire bottle definitely has more than 120 calories. Same idea. You just want to make sure you really get a sense of how many milligrams there are in a serving, how big the serving size is. Are you taking, is a serving 3 drops, or is it serving 3 whole droppers?
Yeah, that makes sense. Yeah, thank you. There are several questions regarding, drug interactions. And I think you mentioned all that we really kind of are aware of right now is liver. There was bortezomib and THC, that study. How can people stay aware of what studies are being done? Are there clinical trials going on? How can they stay up to date with the research that's being done?
Great. I'm not aware of clinical trials for cancer purposes. In myeloma, I know that there's some preliminary work. I know of maybe a couple of CBD trials that are ongoing for solid tumors, but I haven't heard anything be published from those. From a symptom standpoint, there are some trials I know people are working on, looking at like cannabis for chronic pain, cannabis for or CBD for neuropathy, et cetera. I'm not aware of any, like off the top of my head. I'm hoping some of that starts to be published. A lot of them are being done in other countries, like I said. I think your best bet in seeing that is really to, even I just go to kind of PubMed and I periodically search, like I have an alert that comes to me that just says, is cannabis and cancer? And I see articles once, every 2 or 3 weeks, and I read through them. I honestly, like, it's a lot of, frankly, education to get to the point where I can read something very quickly and know whether it is worthwhile data.
Right.
And so it's easy and I'm using this just as a proxy for all other morning shows. It's easy for the Today Show to be like, is cannabis the next cure for pancreatic cancer? And just say it, and then never have to delve into the depths of the research for it. One thing that is helpful, and I'm going to share my screen again just so that people can screenshot this, is I do actually think that this is they do a good job of the NCBI is the National Center for Bibliographic Information. I don't remember what the B and I are, but basically it is a NIH and NCI put together different information summaries. And so they have a cannabis and cannabinoids patient information summary, which summarizes, and they update it periodically in terms of information. And so if there is new research, that is helpful. The other one is, so these are just 2 blogs that I participated in. Sometimes it's helpful because it simplifies it. But MSK has an About Herbs website, which is generally a resource for all kinds of different supplements and what exists in terms of cancer. but we do have a cannabis listing. So as new information comes up, we try to update that. But I would probably say this cannabis and cannabinoids PDQ. If you literally Google cannabis PDQ, it'll pop up. And that is a really great resource. There's a professional version that I will send to other peers so that they're able to see it in kind of a really nice summary. It talks about every level similar to what I told you. So.
Okay, awesome. Kind of just to go along with that really quickly, we don't know cancer drug effects, but do we know how it affects low dose aspirin or blood thinners at all?
Sure. So it shouldn't have an effect on low dose aspirin or blood thinners. I mean, the thing about it is it depends on the blood thinner. A lot of the blood thinners have a lot of activity at the liver enzyme, at the various liver enzymes, particularly warfarin, which is very complicated in terms of a thing. So like I said, oftentimes your provider, there's a website that we use frequently called Lexicon, which we used to use drug interactions. And if you put in Marinol and Epidiolex as proxies for cannabis, they'll be able to see what kind of interaction it has with any kind of medication. So let me see if I can just show you what that would look like.
Okay.
Oh, it's being annoying because it wants me to be a subscriber and I have to do it through my, yeah, it's having me do it through, but basically there are all kinds of searches you can do for drug interaction searches. And you would be able to basically put in Marinol and Epidiolex.
Okay.
Cannabidiol.
You want to, and maybe you can email me the link and I can send it out to them or something like that. Okay, great. One of the questions, kind of, you already covered this, but I think it's a great question. Is topical CBD oil helpful for neuropathy? I think people are looking, for solutions to their neuropathy.
There are 2 studies. So there haven't been studies in chemo-induced neuropathic pain. There's one study of a general neuropathy. I think it maybe have been diabetic neuropathy that looked at a topical CBD and did find a benefit. It was a small study. I will say I often consider using CBD topical because its absorption is relatively minimal, so I'm not worried about interactions the same way. It's well tolerated. I cannot, again, endorse any products or anything, but one thing I will tell you is, again, practice a little bit of the buyer beware. There are a lot of products out there that will sell as CBD oils or creams that will have a very minimal amount of CBD. So if you take a bottle, like a 3-ounce bottle of lotion and it says 100 milligrams CBD, well, that's basically 1 milligram per milliliter. It's a very, very small amount. And so just be really thoughtful. Honestly, CBD, refining and extracting it is an expensive process. So if something is amazingly cheap, I would question whether it actually has CBD.
Whether it's successful, yeah.
Like if you're buying a $10 CBD lotion, it doesn't.
It's probably not worth it. Okay, and then
it might make your hands very soft, and I think that is always
yes. One question that I wanted to make sure we asked is, how do we know whether the product we're buying has mainly CB1 or CB2 receptors?
So it's not about, right. So CB1, so it's not like that. The CBD doesn't really have as much activity on the CB1 receptor. What it does is increase our natural amounts of CB1, of our natural cannabinoids. And so taking in CBD doesn't really have an effect on CB1 receptors. Only THC has effect on CB1 receptors. CB2 receptors, we just don't know. Like, we don't know how much and what its effect would be on any individual person. But CBD tends to have more effect on CB2 receptors, but plus minus. How it that's the other reason why these like preliminary studies are so important, is like, we don't know the mechanism. So while it could be CB2 receptors, CBD also has effects on serotonin receptors. It also has effects on these vanilloid receptors, which are part of like inflammatory pathways. Like, we don't know through which mechanism it is potentially affecting or improving the circumstance. And so when something is really complicated like that, you know, targeting is what exists right now is not specific enough to target like that. That would be further research that is like a lot more isolated out. Yeah.
Okay. We have one patient who's saying, or one caregiver who's saying that giving her husband hemp soaks in for his feet has helped with his neuropathy.
Yeah.
What does that mean? What is a hemp soak, and what is required to do that?
So it would depend on what the hemp. So hemp is just the cannabis plant without the THC. It would depend on what the soak contains. So if it's hemp with CBD, I can imagine that being a little bit like a topical. So there's probably some benefit to that. The soak itself might be some of the benefit. There's hemp is that oil. It has hemp oil itself has a lot of omega-6s and 9s. And so maybe it's helping with some of the lipo barrier of the skin. So that soak might actually help with some of this maintaining the integrity of the skin. And that might be part of the components of the hemp that's helpful. It would really be hard to tell unless the hemp, whatever product is being used in the hemp soak is specifically analyzed for the components. So a hemp soak could also literally be hemp plant, right? The same cannabis plant that people think about smoking or making into a brownie, put into water. Well, that hemp plant could have all kinds of things in it. We just don't know. In any cannabis plant, any species varietal that you get, you can have up to 100 and more than 60 different chemicals in it. And so the composition can be very different plant to plant. So it's really hard to say. And that's why I feel that much more uncomfortable with utilizing flower product or plant product as a part of therapy, because you just don't have a predictable understanding of what you're getting. And very, very strongly feel, I'm gonna put this out there. The whole RSO thing is very, very concerning, because people are given recipes to just buy cannabis plant and make their own oils without really thinking about the safety of that oil, meaning like, are you actually bringing in any bacteria or something concerning the composition of that oil? So how much, when you distill or bring out that oil, how much actual of the subcomponents you're getting? So I would just throw out there, like, anything you make at home, I would not do. I think you run a real risk there.
Yeah, completely. Well, thank you so much. We'll just finish up one more time. If you can just tell us that organization that rates the CBD.
Yes. It's the U.S. Hemp Authority.
Okay. I'm going to type that into the chat.
Yeah, U.S. Hemp Authority is that. And then if you want to type out Cannabis PDQ, that's the information sheet from the government. Yeah.
PDQ. Okay. Information sheet from the government. That was amazing. Thank you so much for this presentation. That was exactly what I was looking forward to. So I really appreciate you taking the time. I'm going to finish up with just a couple outro announcements, but thank you. Thank you so much. All right. So I'll go through these briefly, but while we're still working on the details, we hope to bring you another highly anticipated topic, which is navigating neuropathy with nutrition, in January of next year. And we will keep you updated with more details as it gets closer. You may be interested in other myeloma crowd community events we have coming up. Tomorrow is our African American myeloma chapter. Let me move this just in case it's blocking. On Wednesday, the 8th, we'll be talking about how to handle the holidays and enjoy our desserts. And then on Wednesday, the 15th, we're going to be talking about diet choices that put us back in control of our health. The link to sign up for those events is found at the bottom of this slide and will be sent up in the follow-up email. Another thank you to our sponsors, Bristol Myers Squibb, Takeda Oncology, Karyopharm Therapeutics, Adaptive Biotechnologies, Oncopeptides, Janssen Oncology, AbbVie, Sanofi, Amgen Oncology, and Genentech. And thank you to each of you for helping us build a strong myeloma crowd community. We appreciate you and hope that you have a great rest of your day. Thank you so much.